Colorectal cancer is currently the third most common cancer worldwide and causes the second highest number of cancer-related deaths behind lung cancer. It has a lifetime risk of around 1 in 15, and risk factors include older age, as over 90% are diagnosed over the age of 50 and 60% over the age of 70. However, there is a rising incidence in younger patients, and the reason is not currently known. Colorectal cancer is more common in males than in females. Being overweight, being less active, excessive alcohol consumption, and smoking are all also risk factors. Diets rich in processed and red meat or low in fiber, and a history of adenomatous polyps or inflammatory bowel disease increase the risk of colon cancer too. Most people diagnosed with colorectal cancer do not have a family history of it, but having a relative who is affected does mean an increased risk. This is why screening takes place earlier at around 45 years of age or 10 years before the age at which the family member was diagnosed. There are also disorders like Lynch syndrome, also known as familial adenomatous polyposis, and conditions like hereditary non-polyposis colon cancer that lead to significantly higher risk.
Cancer in the large intestine is called colorectal cancer. The parts of your large intestine are the colon, rectum, and anal canal. Most colorectal cancer starts in the colon, in small clumps of cells called polyps. Most polyps are benign, which means they contain abnormal cells that aren't cancer and won't spread to the rest of the body. They are only in the thin layer of tissue lining the inside of the intestine. If the abnormal cells become cancer cells, the polyp can grow bigger and invade deeper into the wall of the large intestine. If not treated, cancer cells can enter the bloodstream and spread to nearby lymph nodes. Over time, these cells can travel to other organs and form more tumors.
Polyps can be of various types, some of which are more likely to develop into malignant tumors than others. Early-stage colon cancer generally produces no symptoms. Advanced stage symptoms vary, depending on the location of the tumor, and may include changes in bowel habits that persist for weeks, blood and stool, abdominal pain and discomfort, constant feeling that the bowel doesn't empty completely, fatigue, and unexplained weight loss. Early detection is the key to prevent colon cancer. Because a precancerous polyp usually takes years to develop into a malignant tumor, colon cancer can be effectively prevented with regular screening. There are two major types of screening tests. Stool-based tests. Stool samples are examined for signs of cancer, such as blood and mutated DNA. These tests are non-invasive, but less effective and need to be done more often. Visual screening, such as colonoscopy, is more reliable and can be done every 5 or 10 years. Colonoscopy uses a long, flexible tube equipped with a camera and light to view the entire colon. If polyps or abnormal structures are found, surgical tools are passed through the tube to remove polyps or take tissue samples for analysis. Typically, any polyps found in the colon are removed during colonoscopy and examined for precancerous changes, known as dysplasia. If high-grade dysplasia is detected, a follow-up colonoscopy is required to monitor the condition. Colorectal cancers are caused by mutations that increase the rate of cellular division. Some of these mutations can be inherited from parents. Examples of inherited colorectal cancers include familial adenomatous polyposis, or FAP, a condition caused by mutations in the APC gene. The APC protein acts as a tumor suppressor, keeping cells from growing and dividing too fast. Mutations in APC result in uncontrolled cell division, causing hundreds of polyps to grow in the colon. FAP patients usually develop colon cancer by the age of 40. Lynch syndrome, another inherited condition caused by changes in genes that normally help repair DNA damages. A faulty DNA repair results in increased rate of mutations. Patients are at high risks of colorectal cancer, as well as other types of cancers. In most cases, however, the mutations that lead to cancer are acquired during a person's life, rather than being inherited. The early event is usually a mutation in the same APC gene that is responsible for FAP. While FAP is a rare condition, APC mutations are very common in sporadic colorectal cancers.
You may have a higher risk for getting colorectal cancer if you have a family history of colorectal cancer, have colon polyps, are age 50 or older, are obese, smoke cigarettes, aren't physically active, drink too much alcohol, or have a disease that inflames your colon, such as ulcerative colitis or Crohn's disease. Symptoms for colorectal cancer can include a change in bowel habits, such as diarrhea, constipation, or having stools more narrow than usual, bright red or dark blood in the stool, feeling unable to empty your bowel, belly pain, bloating, or cramps, unexplained weight loss, feeling weak or very tired, and vomiting. It's important to know that these symptoms can be caused by conditions other than colon cancer, and it's possible to have colorectal cancer without any symptoms, especially in the early stages. Treatments for colorectal cancer include surgical procedures, chemotherapy, and radiation therapy. Early cancer or polyps may be removed during a colonoscopy. During this procedure, a flexible tube will be inserted through your anus. In most cases, if a polyp is found, it will be removed. If a small area of cancer is found, it will be removed. For larger areas of cancer, you may need to have a surgical procedure to remove the affected part of your large intestine. Your surgeon may remove part of your colon, or part or all of your rectum. Nearby tissue, such as lymph nodes, may also be removed to see if cancer has spread there. In most cases, the remaining ends of your large intestine will be reattached. But sometimes the surgeon will not attach the remaining ends right away. Instead, a procedure may be done to attach the top end of your large intestine to an opening in the skin of your abdomen, and the bottom end will be closed with staples or sutures. This new opening in the skin allows solid waste to empty into an attached bag. Usually, the opening is temporary. If temporary, the ends of your large intestine will be reconnected in a later procedure. Chemotherapy, radiation therapy, or both may also be recommended, either before or after a surgical procedure. Chemotherapy uses drugs to attack and kill cancer cells. Radiation therapy is often used along with chemotherapy. The high-energy rays in radiation therapy attack and destroy cancer cells.
Research tells us that up to 1/2 of cancer cases are preventable through healthy lifestyle behaviors. You can reduce your risk for cancer by following these 8 recommendations. Being overweight or obese can increase your risk for several types of cancer. You can reduce your risk by maintaining a healthy weight. Eating a healthy diet can help you stay lean. Fill 2/3 of your plate with vegetables, fruits, and whole grains. Limit foods like red meat and processed meat. Being physically active reduces your risk for many cancers. It can also help you maintain a healthy weight. Aim for at least 30 minutes of physical activity 5 days a week. If you don't smoke or use tobacco products, don't start. If you do smoke, even occasionally, it's never too late to quit. Your health will improve immediately and continue to improve over time. The HPV vaccine is the best protection against HPV-related cancers. All boys and girls between 11 and 12 years old should get the HPV vaccine. The best way to protect yourself against skin cancer is to limit your exposure to the sun's UV rays and eliminate tanning bed use. If you must be in the sun, use sunscreen with SPF 30 or higher. If you have a family history of cancer, you may be at increased risk. Talk to your family about their medical history so your doctor can assess your risk and help you take precautions against cancer. Screening exams help detect cancer early when it's most treatable. Talk to your doctor about the appropriate screening exams for you based on your gender, age, and risk factors.